Peter Block here in Orlando at the AHA annual meeting, and with me is Marc Bonaca from the Brigham and Women's in my old sort of hometown, Boston. Marc has done the PEGASUS trial, and now we have a new iteration of PEGASUS, a follow-up. So Marc, tell me sort of in retrospect, what was PEGASUS and now what this evaluation is?
PEGASUS-TIMI 54 demonstrated that initiating ticagrelor in stable outpatients with prior myocardial infarction reduced future ischemic risk. We saw more discontinuation with ticagrelor than placebo. And of course, the natural translation of the PEGASUS-TIMI 54 results in clinical practice would be continuation at 1 year in a patient already tolerating therapy after myocardial infarction. So in this analysis, we explored the tolerability of ticagrelor at both doses, the 90 milligram dose studied in ACS and a new 60 milligram dose. And we studied tolerability within the first year of exposure and after the first year of exposure. And then we did an exploratory analysis looking at treatment effect in patients remaining on therapy. And we discovered that discontinuation primarily occurred in the first year of therapy. The difference was primarily early on. And those patients that made it to a year on treatment had low rates of discontinuation subsequently. And in the exploratory analysis, we saw that, as you'd expect, on-treatment effects were more robust than the overall ITT analysis.
Okay, so the control group here was only aspirin alone, right?
That's right.
So aspirin versus quote-unquote dual therapy with ticagrelor and aspirin together. And tell me about the outcomes, because even though the discontinuation is interesting because of the dyspnea issue and the bleeding issue, what about outcomes?
Yeah, overall outcomes were reduced with ticagrelor versus placebo, including consistent reductions in cardiovascular death, myocardial infarction, and stroke, which was the primary endpoint of the trial. And certainly for those patients that remained on therapy, we saw a more robust efficacy signal than even in the overall ITT analysis that had been previously presented.
Okay, so ticagrelor we knew was good for acute coronary syndromes, number one. Number two, now we have evidence that you should maybe keep patients on it. So I have to ask you a question that all the docs out there are about to ask themselves. What's so great about ticagrelor versus Plavix? Why, if it's dual platelet, why don't we do the old standard aspirin and Plavix versus ticagrelor and Plavix? Give me the answer to that one. Or what would you say to that?
Yeah, I think it's a great question. It's really at the core of this analysis. The decision of which P2Y12 inhibitor to reach for really happens at the time of ACS. And there from the Plato trial, we have convincing data showing that ticagrelor is superior, including reductions in ischemic events and mortality. After that choice, then the question that PEGASUS answers is, what do we do at 1 year? Do we continue ticagrelor or do we stop? And now we have evidence to show that continuation provides ongoing ischemic risk reduction.
Okay, so for all the practicing docs out there, you know, I'm reminded of an end line of a movie from many, many years ago. Keep your eye on ticagrelor. It may be that, in fact, this is a drug that we probably will be using in the future. Would you agree?
I think so, yeah, and the guidelines would support that as well.
Thank you, Marc.